Hello, this is Dr. Pete, and I'm coming to you from my office at work. And I wanted to spend a few minutes talking about four things. I was a college student in my senior year, and I took a course called bioethics. And I went to a liberal arts school where you took philosophy courses all throughout your 4 years of school. And my favorite philosophy course was bioethics. One of my favorite quotes from one of the books we read was, and this is going to sound weird, but death is the father of beauty. And it just goes to show that sometimes you need tragedy to understand how beautiful and wonderful things are. And that is a very important part of the human experience. So getting that out of the way, let's talk about the four principles or four pillars of bioethics. That is patient autonomy, beneficence, non-maleficence, and justice. And I'm reading something I kind of wrote down for myself on the screen. So autonomy is the patient's choice, the parent's choice, and also something called informed consent. Beneficence is doing good. So doing things that help the patient, doing things that make the patient feel better, doing something that alleviates pain. Non-maleficence is do no harm. Don't do things that cause pain or harm unless it is absolutely necessary for life-saving reasons. And then justice is doing the greater good for the community. Do what's best for the community as a whole as opposed to the individual. So sometimes justice and autonomy are at odds in certain subjects. So the first reason why one of these four principles might get more of a back seat instead of the front seat is vaccines. Vaccines rely on two very important principles. It's all about justice, meaning helping the community be healthier and safer by making sure as many people that can be vaccinated can be vaccinated to reduce the spread of infection to the community. Number two, vaccines are the principle of beneficence, doing good to prevent a severe infection in a patient or in the community. There is some harm in a vaccine. It hurts. It's a needle. And there are adverse reactions, which are exceedingly rare and almost never permanent. So patient autonomy is put to the forefront in terms of when you give a vaccine, you get informed consent. The problem that we run into is informed consent has to be information that's evidence-based, and it has to be telling the patient the risks and the benefits, which they usually understand. The risk is getting the infection. The benefit is not getting the infection or not getting as severe a version of the infection. The risk of the vaccine itself is typically it makes your arm sore, it gives you a low-grade fever, and then there's more rare adverse reactions. But to this date, we have no evidence of any permanent harm caused by vaccines in a widespread, clinically significant way. So we're concerned that people, especially parents that are hesitant or even outright refusing vaccines, that they have misconstrued the risk of the vaccine itself versus the risk of the disease. Let's focus on teaching parents bioethics, in that I want them to understand that their autonomy is important to me, that their choice, that their informed consent is very important to me, but that the justice of the community being protected is also important to me, that doing what's best for the patient, beneficence, is important to me. And I don't like the fact that vaccines hurt. I realize that I'm not doing non-maleficence. I am giving a shot. It hurts. and I want to minimize that. But sometimes we do things that are painful and unpleasant to prevent and protect. So I feel like if we could have people understand where we're coming from as healthcare professionals, that we have these principles in mind when we're making a decision, and that sometimes these principles are at odds with one another. When you are an older adult, the principle of non-maleficence kind of creeps up higher, because older adults have lived a long time, and maybe treating them with certain treatments and doing certain interventions is cruel or painful, even if it's life-saving. So we may practice more palliative care in the older adult. We may have a different set of thresholds in a very young patient. We may want to be more aggressive, even if it is painful, because their life is so full and ahead of them. So, I mean, there's different stages, different ages, and different uses of these principles. It's important to understand that we use them in different amounts. We value them more in different treatments. It's important to understand, like something like antibiotics. There are a lot of side effects with antibiotics. So that's where non-maleficence is challenged by antibiotics. Beneficence is that, the do good of antibiotics is you kill the infection. The autonomy part is that, patients know there's side effects from antibiotics. We tell them, we remind them each time. But they in essence, it's in their best interest to choose to take the antibiotics if there's a diagnosed and proven infection that needs an antibiotic. And then the justice part is that if I treat you, then I don't spread this infection to the rest of the community, but it also requires participation in infection control from that patient by not going around other people while you're still sick and while you're still contagious. So, these principles are what guide us. They don't sound religious because they aren't. Bioethics is not supposed to be religious. It's supposed to be about balancing the 4 pillars and knowing that at different times and stages in a patient's life, certain pillars are more important than others, and that certain treatments, one of the pillars is more important than the other. That is how medicine works. That is how science should work when it is dealing with the treatment of patients. And we want to do the best for our patients, but sometimes that requires some understanding and some learning on the part of the parent or the patient so that they can make the best decision. We really hope that they don't use information that is false. We really hope that they don't use information that is based in propaganda and was designed to mislead them, which is what we call disinformation. But we know that parents out there consume information many ways, and one of the saddest ways is when they get misinformed, or worse, disinformed. We want them to understand that disinformation is designed to harm them. It's designed to put a wedge between me, the doctor, and you, the patient or parent, so that you make a poor decision and you are harmed. If you are harmed, then they can blame us, and then they can say, here's a supplement we want you to buy. That's the point of disinformation, is to distract you from what you should be doing for yourself and then get you to do something that is profitable for the disinformationist. So good luck out there, and I hope this is a helpful video. I hope you can learn a little something. I am very fond of bioethics, and I think it's something we could use together as doctor and patient to help make decisions every day.